represent Obiabo Federal Constituency. I'm an Ikore man from Rivers State. My dear colleagues, I rise to seek your leave that I take a matter of urgent public importance this morning. I draw strength from Order 8, Rule 5 of the House Rules, and the matter is one that has to do with the outbreak of cholera in the country. I think it is one that requires urgent input, discussion, and perhaps a legislative solution that we can prefer to it. So I pray that you see it as urgent and important enough for us to discuss this matter this morning. I so move, sir.
Mr. Speaker, my name is Honorable Chief Mitema Obodo, speaking for Ogbia Federal Constituency. I'm from Bayelsa State. Mr. Speaker, I think the motion before this humble house, this great house, is urgent enough, and I hereby second the first leg of the motion. Thank you.
We need to check the outbreak of cholera in Nigeria, and it is sponsored by my humble self and two other members, Dr. Adesola Adedayo and Honorable Khadija Buka Ibrahim. The House notes with very serious concern the recent outbreak of cholera in Nigeria, in Lagos State, as well as several other parts of the country. The House also notes that the latest outbreak of the disease in the country, which has been reported and confirmed by the National Center for Disease Control, NCDC, raises very serious public health concern for the government and citizenry alike. The House notes also that the outbreak of the disease, which was first widely reported in Lagos State, is now reported to have spread to other parts of the country, with several casualties and deaths reported. The House is aware that health is of utmost importance and one of the key areas that government ought to give priority attention in order to enhance the well-being and overall welfare of the people. The House is also aware that according to NCDC, while the latest outbreak of the disease have been reported in Lagos and 31 other states across the country, including Abia, Bayelsa, Bauchi, Cross River, Delta, Imo, Nasarawa, Katsina, and Zamfara states, amongst others. The House is concerned about the public and personal health of teeming Nigerians, largely due to lack of access to clean water, poor sanitation, poor personal hygiene, etc. The House is worried that there is an urgent need for quick action or intervention by the federal and respective state governments to curb the disease from further spread across the country. The House is also worried that unless urgent and proactive steps and measures are immediately adopted, the disease would spread to several other places and possibly escalate than imagined, and this would not be good for the health of the citizenry and the country at large. The House is also resolved to urge the federal government and respective state governments to urgently put in place measures to effectively check the outbreak of cholera in the country. 2, mandate the House Committees on Information, National Orientation, Ethics and Values to oversee the rigorous public orientation, enlightenment and education of the citizenry on the need to maintain personal hygiene at all times by relevant government agencies. 3, mandate the House Committee on Healthcare Services to urgently liaise with relevant stakeholders in the health sector to investigate the root cause and solutions to the outbreak and report back to the House within 2 weeks for further legislative action or intervention. I so move, Mr. Speaker.
Those against any? The ayes have it. This motion is referred to Committee on Information and National Orientation, as well as House Committee on Healthcare Services.